It's different.
It's the same.
Karen, you're not listening.
I am listening. You're just wrong. We're all the same. HIV is HIV.
Hey, what's up, you two?
We're doing a report on HIV. Karen thinks it affects everyone the same. I am trying to tell her it doesn't.
It's the same for everyone. If you get HIV, it attacks your immune system, no matter who you are.
Well, you're both right. It doesn't affect the body differently. But there are differences in how it affects communities. I'm actually taking a course in health disparities, and we were just talking about this today.
Health
what?
Health disparities. Here, let me share Michael's screen so I can show you a few things. A health disparity is when a disease affects some groups of people more seriously than others.
Wait, I thought HIV wasn't that serious anymore.
It's still serious. We just have more treatments that can help people living with HIV stay healthy throughout their lives. But it wasn't always that way. At the height of the epidemic in the 1980s, some people thought only gay men, transgender women, and people from Haiti got HIV. This led to a lot of bias and fear towards these groups of people. Most of the people in charge of things in government and at big corporations weren't members of these groups. So, for them, finding a cure or a treatment wasn't a high priority. That meant people with HIV were dying pretty quickly after being diagnosed. This is an example of a health disparity that was caused by homophobia, transphobia, and racism. In fact, it wasn't until a white teenager named Ryan White got HIV through a blood transfusion that the government started funding HIV prevention and treatment. Weren't the first HIV medications really expensive? Yep, only rich people could get them. Others had to find cheaper medications illegally or were left untreated. That's an example of a health disparity caused by classism. Classism is the incorrect belief that wealthy people deserve something, in this case healthcare, more than anyone else.
But aren't things better now?
For some people living with HIV?
Yes, a lot is different today. There are more HIV medications, and they are more affordable.
But racism and homophobia still exist, right?
Yep, so people of color may not feel safe going to a healthcare provider if they've experienced racism at a clinic before, or just because of the racism they experience on a daily basis.
Same for gay and trans folks, right?
Right. And HIV medications are still expensive. If someone's unemployed or is homeless, it's still going to be hard to get treatment. HIV may affect everyone's immune system the same, but HIV and other diseases affect individuals, families, and whole communities differently based on people's income, race, immigration status, gender identity, sexual orientation, and more.
So HIV doesn't exactly affect everyone the same. Boy, I still have a lot of learning to do.
Well, before you do all that learning, can we finish our report on HIV that's due tomorrow?
Looks like my work here is done. Whoa!
I'm okay.